and welcome. We're so glad you're here. This short video will walk you through what to expect with Ketamine Assisted Psychotherapy, or KAP, here at Transcend. Starting any new treatment can bring a mix of hope and uncertainty. Our goal is to help you feel informed and supported and comfortable throughout the entire process. Ketamine has been safely used in medicine since the 1970s when it was FDA approved as an anesthetic. Although research on KAP began decades ago, recent studies continue to confirm how powerful it can be, especially for people who haven't found relief with traditional medications or talk therapy. Ketamine is FDA approved for anesthesia, but its use in mental health is considered off-label. That's very common. Many medications are prescribed off-label when strong evidence supports new benefits. At Transcend, we follow strict, research-backed protocols to make sure treatment is both safe and effective. Ketamine is extremely safe when administered under medical supervision. During treatment, we monitor your vital signs closely. Most people experience only a mild temporary increase in blood pressure or heart rate, similar to gentle exercise. If you have certain health conditions like high blood pressure, heart disease, or sleep apnea, our medical team will review your case carefully before treatment. At your intake appointment, we'll go over your medical history, check your vitals, and perform an EKG. Ketamine has a very low risk of addiction when used medically, but if you do have a history of substance use, please tell your provider so we can support you appropriately. Ketamine acts mainly on NMDA receptors in the brain, which influence the neurotransmitter glutamate. Because of this, it can help when traditional antidepressants and pain medications don't. It also promotes neuroplasticity, your brain's ability to form new pathways and become more flexible, open, and responsive to therapy. While ketamine alone can reduce symptoms, pairing it with psychotherapy leads to deeper and long-lasting progress. After your intake with both a medical provider and a therapist, you'll begin a series of KAP sessions. Most people do one session per week for 6 to 10 weeks. Some need more, and occasional maintenance sessions within that first year can help sustain progress, especially for chronic pain. Here's what to expect during a KAP session. You'll complete a short well-being survey. Medical staff will check your vitals and start your IV. Then the therapist will come in and meet with you to set goals for the session. The infusion will run for approximately 30 to 45 minutes, and both your therapist and nurse stay with you the entire time. You may experience changes in how you perceive time, space, or your body. Some describe it as a dreamlike or deeply reflective state. You are always safe, and your care team stays right beside you to support you. After the infusion, you have additional time with the therapist to process what unfolded during the ketamine experience. That day, you may feel tired or groggy, so plan for rest and do not schedule any stressful activities or make any major decisions. You may not operate a vehicle for the rest of the day. Your mind may continue processing for hours or the next day or two after the session, and that's why we offer integration sessions where you can reflect with your therapist on what came up during treatment. If you already have a therapist outside of Transcend, that's great. KAP is meant to enhance, not replace your existing therapy. But if you ever need more time to talk between sessions, please let us know. We're always here to support you. KAP works best when supported by a healthy lifestyle, so eating well, exercising, and getting good sleep can all help to strengthen your progress. We do offer coaching services to help with lifestyle changes should you need that. And our psychiatric nurse practitioner is available to provide medication management for patients who are considering taking or already take medication. We can adjust prescriptions safely alongside your KAP treatment plan to create a well-rounded plan that supports healing from every angle. Try not to search online for other people's ketamine experiences. Everyone's journey is unique, and what you read online often doesn't reflect what happens here at Transcend. Our process is structured, medically supervised, and combined with therapy in a specific, evidence-based way. If you have questions, please bring them to your care team. We're here to provide clear and accurate information. Everyone's journey is different. Some people feel better right away, while others notice a temporary increase in symptoms before improvement begins. That can be discouraging, but it's actually a normal and meaningful part of the process. Healing can bring old emotions or patterns to the surface before things lighten. You may feel more emotional or sensitive in the days after a session, so please give yourself space and kindness. You're doing deep work. To track your progress, you'll complete a short well-being survey called the OQ45 before each session. This graph represents what we often see, a slight early increase in symptoms followed by steady improvement as treatment continues. Think of it as a healing curve, not a straight line. Even when things feel harder, your brain and body are reorganizing and healing. We'll review your scores with you as needed so you can see your progress unfold. The two most common physical side effects of ketamine are mild nausea and headache. To help minimize these, please stay well hydrated in the day or two before your session. Hydration also helps ensure a smooth IV start. To reduce nausea, avoid eating within 3 hours of your appointment and wear your eye shades throughout the infusion. We do have nausea medication should you need it. It's normal to have questions before starting KAP, and you'll have the chance to discuss these during your intake appointments. Our mission is to help you feel safe, supported, and empowered every step of the way. Thank you for entrusting us with your care, and we're honored to be a part of your healing journey.